It all kicked off on a pretty normal Sunday. For a man named Emery Davis, it was just the usual trip home from work. But what he didn't know was that an ordinary city bus ride was about to trigger a really terrifying medical mystery, one that would send doctors on a high-stakes investigation where literally every single minute counted. So let's follow the clues together. Here's Emery describing the exact moment it all began, in his own words. He said the bus driver hit a series of speed bumps, way too fast. The first jolt actually threw him right out of his seat. He stood up to try and brace himself. But the second one? It was even worse. It launched him completely off the floor of the bus. Just a violent, shocking moment. And just look at this timeline. It shows you how fast everything went downhill. Sunday evening, right after that bus ride, he just felt a little wobbly. Maybe you just brush it off. But by that night, his balance was getting a lot worse. Then, Monday morning, that's when things took a really frightening turn. His left leg was so weak he had to physically lift it with his own arms just to get his shoes on. By the afternoon, he actually fell in his yard, and that was it. By that evening, he was in the emergency room. Okay, so you have to understand, when a patient shows up in the ER with sudden, severe weakness on just one side of their body, all the alarm bells in the hospital start screaming one word: stroke. It immediately becomes the prime suspect, and the investigation has to be lightning fast, because when you're dealing with a possible stroke, you are absolutely racing against the clock. So the very first thing they do is activate a code stroke. This is like pulling the fire alarm for the neurology team. It's an all-hands-on-deck emergency alert that gets a specialized team moving stat. Emery was immediately rushed from the ER to the scanner for a whole series of high-speed images of his brain. The detective story had officially begun. The very first test is a basic CT scan of the brain. You can think of it like a quick recon mission. Its number one job is to answer one single critical question, and to answer it fast. Is there any bleeding in the brain? Because if there is, a lot of the go-to stroke treatments are immediately off the table. And the first piece of evidence came back negative. The radiologist's report was crystal clear. This phrase, no acute parenchymal hemorrhage, is just a technical way of saying there was no bleeding in his brain tissue. The final impression basically says we don't see anything acutely wrong here. So the most obvious cause was ruled out right away, which meant our detectives had to start digging a whole lot deeper. So the next test on the list was a CT angiogram, or a CTA. For this one, they inject a special dye into his veins that basically lights up all the arteries in his brain. It's like creating a super detailed roadmap of all the brain's plumbing so you can look for any big blockages or, traffic jams. And guess what? The results came back clear again. The report shows no large vessel occlusion, that means a big, major clot, and no significant narrowing or aneurysms. All the major highways supplying blood to the brain looked like they were wide open. Another dead end for the investigators. All right, so with the first two tests coming up empty, the team decided to bring out the heavy artillery, the CT perfusion scan. Now, this is an incredibly sophisticated test. It doesn't just look at the pipes, it measures the actual blood flow getting into the brain tissue second by second. It can calculate the precise volume of the brain right down to the milliliter that might be damaged. And after all of that incredibly complex analysis, the result was, well, it was stunningly clear. The estimated volume of brain tissue that was damaged by a stroke was exactly 0. A big, fat 0 milliliters. I mean, that's about as definitive as a piece of evidence can possibly get. And right here, this was the major turning point in the case. The prime suspect, a stroke, now had a rock-solid alibi. You had 3 different, rapid, really advanced brain scans, and they all came back negative. All the easy answers were gone, and the mystery was only getting deeper. So this is the question that's now hanging over the entire medical team. Emery is obviously weak, something happened to him, and it happened suddenly and severely. But if the problem wasn't in his brain, where on earth could it be? Before they completely abandoned the whole stroke theory, the detectives needed one last piece of evidence, just to be absolutely sure. They ordered an MRI of the brain. See, while a CT is way faster, an MRI is far more sensitive. It's really considered the gold standard for spotting even the most subtle brain damage from a stroke. And here it is, the final verdict, straight from the MRI report. No MRI evidence of an acute intracranial process.
And it even specifically calls out no acute infarct, which is just the medical term for a stroke. That's it. The prime suspect was officially cleared of all charges. The case was now blown wide open, and the entire investigation had to pivot.
So, with the brain completely ruled out, the detectives had to look somewhere else. The electrical signals that control our muscles, they travel from the brain, down the spinal cord, and out to our arms and legs. So, if the problem wasn't at headquarters, maybe it was somewhere in the wiring. The focus of the investigation shifted from the head down to the spine. So you can see the shift right here. The brain investigation was officially closed. The CTs were negative, the MRI was negative, case closed. So the detectives turned their attention to a brand new lead, the spine. And this new focus was really prompted by Emery's history of falls and the very specific pattern of his weakness. So the team ordered MRIs of his entire spine. The lumbar scan, that's the lower back, it did show a disc herniation. The thoracic, or mid-back, showed some general, wear and tear. But it was the cervical MRI, the one looking at his neck, that contained the crucial piece of evidence they had been searching for all along. And the key finding was something called cervical spinal stenosis. Okay, so what is that? Essentially, the bony canal in your neck that protects your spinal cord had become narrowed over time because of arthritis and other changes. And this meant the spinal cord, that superhighway of nerve signals, had less and less room to move, and it was really vulnerable to any kind of pressure. And this quote, right from the cervical MRI report, is the smoking gun. At a very specific level in his neck, the report describes how a mix of disc material and bone spurs now contacts and mildly deforms the surface of his spinal cord. In other words, there was direct physical pressure being put on that critical bundle of nerves. They could actually see it. So, with all the evidence finally on the table, the crazy bus incident, the sudden weakness, all the negative brain scans, and now this positive spine scan, the neurologist could finally piece together a coherent theory of the case. All the dots were about to be connected. And here is how all the pieces just fit together perfectly. First, Emery had this pre-existing chronic condition he probably didn't even know about, spinal stenosis. Second, that violent jolt on the bus was the traumatic trigger. Third, that sudden trauma likely caused what's called a contusion, basically a bruise, to the exact section of his spinal cord that was already being squeezed. And finally, that acute injury to the spinal cord is what resulted in the sudden and severe weakness down the entire left side of his body. It all made perfect sense. So the mystery of what happened was solved. But as soon as they closed that case, a new question popped up. What's the best way to help Emery recover? The doctors now had a pretty critical decision to make about the path forward. And this created a real dilemma. On one hand, they could go in for surgery right away to decompress the spinal cord and give it more room to heal. But that came with some pretty big risks, especially because Emery was on blood thinners for a heart condition. On the other hand, they could choose watchful waiting. Basically, give his body time to heal on its own with a lot of physical therapy and see if the weakness improved, which would avoid all the risks of surgery. In the end, Emery and his doctors chose the more conservative path. He was sent home with a plan for really intensive therapy and a follow-up appointment with a neurosurgeon. So, while that initial medical mystery was solved, it left us with a new cliffhanger. The question isn't what happened anymore. Now it's what happens next. And that is a story that's still being written.